All right. Well, thank you all again for coming back and joining us for this presentation. We're going to go ahead and get started. So today I have Dr. Rebecca Hunter from Rush University speaking on breast cancer and body image. We know that breast cancer treatment often has many women finding themselves coping with changes in their physical appearance, body image, and concerns about sexuality. Dr. Hunter received her doctoral degree in clinical health psychology from the University of Kansas. She completed her pre-doctoral internship in behavioral medicine at Palo Alto Healthcare System in California and postdoctoral fellowship in clinical health at Loyola University Medical Center in Maywood, Illinois. Dr. Hunter's research and clinical work has centered around psychosocial oncology. As such, her interests have focused on the cancer care continuum with attention to issues specific to cancer prevention, screening, diagnosis, treatment, survivorship, and end of life. Much of her research has focused on quality of life during survivorship, as she has interests in body image, changes in sexual functioning, and health behavior change targeted at reducing risk of reoccurrence.
When you go through surgery, you can experience changes in body image, and that is regardless of the type of surgery that you're undergoing, whether it's mastectomy, double mastectomy, lumpectomy, whether you get reconstruction, you can still experience body image distress as a result of your surgery. Additionally, in terms of a physical impact, we know that depending on how many lymph nodes are removed during your surgery, you could be at increased risk of lymphedema. So meaning that essentially there's a blockage as a result of taking out those lymph nodes, and so there can be excess edema or swelling in your arm. Radiation. So again, changes in body image. There's a pattern here. And that can be related to whether it's changes in the texture of your skin as a result of receiving certain types of radiation, burns that may be associated with it. And then we also know that fatigue is a major side effect of radiation that can be pretty long-lasting. Anti-hormone medication. So here we throw in more hormonal changes. So that means that a lot of women start experiencing menopausal symptoms. That means things like hot flashes, vaginal dryness, arthralgia or joint pain, and weight gain. And then there's chemo, which we just throw in some more. And again, we're looking at things related to both emotional and physical impact of the treatment itself. Now, in addition to what I've already covered that is impacted as a result of treatment, we also know that there's a number of other things that can be impacted. Again, body image, sexual dysfunction, fear of recurrence, depression is a big one, changes to quality of life, changes in relationships. So maybe you're someone who is used to being the one that takes care of other people, and now all of a sudden you're the one who has to ask for help. And that can create, different dynamics in relationships, and that's something that you and potentially your whole family can struggle with. Changes in identity. So from the time you're diagnosed, you are thrown into this complex medical system where you are constantly going to medical appointments, you're constantly going back and forth from the treatment center, and suddenly it feels like your entire life is made up of being a cancer patient. And it's very easy to feel like all of those other parts of your identity that you used to have, it's like they disappear during this period of time. Insomnia. So, of course, when you are, trying to deal with all of these different changes happening in your life and you're experiencing all these different things, you might lie in bed at night just kind of ruminating about things that you're worried about, things you have to do. And so, pretty soon you've been lying in bed for 3 hours and you need to get up in 2 hours to start your day again. And we also see things like individuals having trauma reactions as a result of their diagnosis and treatment. Of course, anxiety, particularly related to the fear of recurrence. So that is that little voice inside your head that is always saying, what if? And of course, the financial strain that you can experience as a result of the medical bills that are piling up, and in the event that you were working and now suddenly you have to take some leave from work, and then maybe you're thrown into this situation where you have to apply for disability, and that is a huge headache in and of itself. So as you can imagine, and as all of you have potentially experienced, there are normal mood fluctuations that occur because of everything you're going through. So I always tell people that those mood changes, it's a normal way to deal with an abnormal situation. It's a lot like a roller coaster. So some days are, pretty good, and other days you just feel terrible. We know that between 20 and 55% of breast cancer patients experience anxiety and depressive symptoms in some capacity. And those rates are higher during that first year following diagnosis. We also know that 30 to 40% of survivors report ongoing fear of recurrence. Again, that little voice inside that's saying, what if? And 26% of breast cancer patients actually meet criteria for clinical depression. So that is experiencing a major depressive episode. Interestingly, we know that some studies show that up to 80% of patients experience subclinical PTSD symptoms. So PTSD is post-traumatic stress disorder. And subclinical essentially means that they don't meet full criteria for having PTSD, but they're experiencing some of the symptoms. So for example, maybe they are experiencing recurring nightmares related to their diagnosis, or related to waking up after surgery and maybe looking at their scars for the first time. And 32% of patients actually meet full criteria for PTSD. And a lot of time, the prevalence rates just depend on the stage of the diagnosis when you were originally diagnosed. And again, with this insomnia thing, very, very common. Between 38 and 61% of patients experience some sort of sleep disturbance, whether it is difficulty falling asleep at night, or you feel like you toss and turn and you're just not getting that quality sleep that you may otherwise be getting. So that's why this little guy might look familiar to all of you. Because these mood fluctuations are so common for people who are going through treatment, it has become a requirement for cancer centers across the United States to implement distress screening. So you have probably filled something out that looks similar to this. This is called the distress thermometer. On the left side of the page, you just rate your distress in general, 0 to 10. On the right side of the page, you indicate which domains of your life are contributing to that distress. And the idea is that based on how you complete the screening, your providers can then refer you to other supportive services, to maybe people like me, who can help you manage those sources of your distress so that you don't feel like your mental and emotional resources are being so strained. Now, obviously, everyone copes with something like this a little bit differently, and research has shown that there tends to be 4 different trajectories of distress when you're going through this. So one is no distress. So you get diagnosed, there's a little blip, obviously, because that's what you would expect. But generally, as you're going from diagnosis to surgery to treatment to survivorship, there really isn't a whole lot of distress. You are coping well. That's great. We also see folks that they start out without a whole lot of distress. They go through, surgery and treatment, and then suddenly they get into survivorship, and it's like, boom. You're really stressed out because you had been spending every day at your treatment center, and then suddenly you go into survivorship, and it's like, well, what am I supposed to do now? and you form relationships with some of the nurses and doctors that you've been seeing so often, and now suddenly you're not seeing them as often anymore. And this can be incredibly stressful. The third is this recovery trajectory. So you start out really freaked out, and then over time, that distress decreases. So it could just be when you first hear about your diagnosis and you start treatment, everything is just so shocking and scary. And then as time goes on, you realize, okay, I have control over this situation. I am doing something to manage this. And that helps some of that distress go down. And then finally, there's this chronic group up here. So you start out stressed and you end stressed. And it's just everything feels so effortful and everything feels so scary the entire time. So fortunately, we have a good idea of things that predict distress and the things that protect against distress. So as you can imagine, predictors of distress includes things like helplessness and hopelessness. So there's nothing I can do to make this better. This is hopeless. I don't see myself returning to my previous life in any capacity anymore. Anxious preoccupation, which is basically this hyper-focus on everything going on in your body, hyper-focus on your disease, on treatment, and it's just like all of a sudden your disease has completely consumed your life. And then cognitive avoidance, which is a big one. So that idea of, I'm just gonna go ahead and not think about this. I'm gonna sweep it under the rug and pretend like nothing happened. Well, unfortunately, at some point, that pot of boiling water overflows. Protectors against distress, a fighting spirit. So I can get on a soapbox a little bit about this. I don't love the term fighting spirit because it sort of suggests that there are winners and losers, and it kind of suggests that if you're not fighting, you're giving up, which is not true. So instead, I like to think of this as having self-efficacy. So believing that regardless of what you're faced with, you are able to persevere through adversity. I can do this. Positive redefinition, which is despite the stressor that you're experiencing, despite even the trauma that you're going through, being able to make some kind of meaning out of it. And then perceived social support. And it doesn't matter if you have one person in your life or if you have 40 people in your life. As long as you perceive that you have that support, then that is going to help protect against distress. All right, so then we transition into two major contributors to distress, and that is changes in body image and changes in sexual functioning. And it's really important that we talk about this because these are two issues that people don't talk about. It's hard for providers to bring up these issues because they might feel embarrassed, and it's hard for you as a patient to bring it up because you might feel embarrassed, and you might think, well, maybe there's something wrong with me, even though actually experiencing these issues is very, very common. All right, so as you can imagine, there's sort of this continuum that we have of people's reactions to changes in body image. And I'm just gonna name some, common examples and maybe more significant or extreme examples that I've heard just from working with breast cancer patients. I've heard things like, I feel mutilated. How can someone possibly find me attractive? Clothes don't look right on me. There is no way anyone is seeing me naked. I don't feel pretty anymore. Every day I look in the mirror and have a reminder of this nightmare. Can I even be considered feminine? I feel like everyone is staring at me, like everyone knows I'm fake and mangled. So as you can imagine, when you have these things going through your mind, that has a pretty significant impact on your overall emotional well-being. So what is body image? The most widely accepted definition is body image includes perceptual, affective, cognitive, and behavioral aspects of the body experience. So that's kind of jargony. What we often think of as of body image is this level of satisfaction with our body. Oftentimes we think of weight, that kind of thing. And when it comes to cancer, and when it comes specifically to breast cancer, sure, that's all relevant, but we also see these other dimensions of body image that are impacted as well. And it's really important that we pay attention to those too. So there's this idea of loss of femininity, changes in energy and strength, body integrity. So that's the sense of feeling natural, healthy, and whole. The sense of control over your health, and also sexuality. I consider sexuality sort of one dimension of that umbrella concept of body image. All right, so I found a couple really well-done videos that are about 5 minutes that were completed by some experts in the field, and also breast cancer survivors sort of shared their experience. So I want to make sure that you all can hear from them as well. And we're going to see if I can figure this out. We're doing good so far.
I guess my perception of myself afterwards was just like, almost like a car wreck or something, where it was just kind of like all these things just happened to me, and I was just, torn apart, and I looked completely different. So it was like just so important to me to find that confidence afterwards, because it just wasn't there naturally anymore.
Body image has a great deal to do with how a woman feels about herself, her sense of self, her self-confidence, and her self-image overall, not just with her body, but just with how she feels about herself in a more global way.
It wasn't the number one thing on my mind. I was more worried about keeping myself healthy and staying alive, but it definitely is another piece to the puzzle of something you have to deal with emotionally going through this.
A woman's body is assaulted in so many ways when she's diagnosed with breast cancer, from the invasiveness of the medical exams, chemotherapy and how that affects a woman's body, and radiation and how that can affect a woman's body. So even when the surgeries aren't as significant, like a lumpectomy, that can have such a significant effect on how a woman sees herself, and therefore how she feels about herself.
Even if clothes fit, I just didn't feel like myself, because for somebody my height, 20 pounds is a lot. So that's where I really want to get back down to the pre-cancer weight. Not only to look like myself, but just to feel like I used to feel.
Individuals may feel like they very frequently have gained weight, their shape is different, they look in the mirror and don't see themselves in the same way.
I didn't realize that when you have a mastectomy, a lot of times you don't get to keep your nipples, so that was really interesting to me.
It's a lot of adjusting, because you have to get used to a new look and finding confidence in yourself that you had beforehand with different aspects of your body.
It's interesting because I've always had a lifelong conflict, concern about my breasts. I've always had large breasts my whole life, and so it's always kind of been the first thing guys would see when we were dating, and I always kind of hated that about them.
Oftentimes, young women who come to the experience of breast cancer already have a negative view of their body. The experience then of surgery, chemotherapy, the fatigue, complicates that sense of self.
I was pretty upset. I didn't really want to go out in public as much. And I was one of those girls who always had my wig on whenever anyone else was around. I think there was only a handful of people that showed my bald head too.
I've had all these physical changes that were out of my control, and now I'm trying to catch up and play catch up and have to work a lot harder to try to feel as good about myself, body image wise, as I did before. And I guess that's just something I took for granted before, that I didn't have to really worry about it.
I actually, unfortunately have a scar that looks a little bit like an areola, and it's just high enough that when I wear a low cut shirt, it's always out. And so I had a guy at a bar sort of make fun of me last night because he was like, "Your boob has been out all night." And I was like, "Oh, that's actually a scar, and I don't even have nipples anymore since the cancer took them." So I try to, make it a little jokey, but also don't take any of that for a minute. Don't let anybody disrespect you or make you feel badly about the way that your body looks, because that's not going to be healthy for you.
So body image was never something that was really brought up with a
Okay.
health professional. And I also feel that they
Okay. Thank you. All right. Oh. Oh. Here. Oh. Thank you. I told you.
I pointed to that, so that was my fault.
Thank you. Okay. So that video really highlighted some of the things that we've been touching on in terms of this multidimensional idea of body image. And it sort of reinforces the point, too, of this sense of sexual attractiveness that also comes up for a lot of patients. So that brings us to this other dimension of body image, sexuality or sexual health. So here's another jargony definition for you. What is sexual health? Sexual health is a state of physical, emotional, mental, and social well-being in relation to sexuality. It is not merely the absence of disease, dysfunction, or infirmity. Sexual health requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination, and violence. So that's a lot. So what does it include? What does it really mean when we break it down? So sexual health includes a lot of different things, and these are just some examples. So it includes how we feel about our bodies. It includes sexual experiences that we've had, or thoughts or ideas of fantasies related to sexual encounters. It's shaped by our environment and the media and family and friends and our religion. It is shaped by how we experience intimacy and touch and joy and compassion and sorrow. And it also includes things like gender identity and sexual orientation. So what happens is essentially when you think of all these different components, it's like this schema of sexual health is created that helps define how you think of intimacy and sexuality. So obviously, that can really be impacted by diagnosis and treatment. So the changes that often occur because of treatment includes changes in the frequency of sexual activity and changes in sexual interest, avoidance, satisfaction, attractiveness, and dysfunction. And specifically within sexual dysfunction, pain during intercourse and difficulty achieving orgasm. So how does this happen? Well, a lot of different factors are at play. So when we look at all these different domains, when we think of the biological domain, that is more related to the direct physiological, physical impact of treatment on your body. So for example, throwing you into menopause or keeping you in menopause and you're experiencing all those symptoms that I mentioned earlier. The emotional side is incredibly important. So if you are experiencing increased anxiety or increased depressive symptoms, you're probably not going to have as much sexual desire. Cognitions are also incredibly important. So if you are having thoughts like, my partner doesn't find me attractive, that is also going to impact your sexual health and sexual functioning. So all of these different domains are impacting that schema that you develop of sexual health and sexual well-being. All right, so we're going to do another video. Look at me go.
I always like to start this by making the distinction between sexuality and intimacy.
Oh, sorry. That's okay.
together, of course, the intimacy in some ways becomes closer because you're kind of going through this emotional struggle, but the sex part immediately becomes, at least in my experience, it was just much more difficult. It was awkward. It was, you try to embrace and it's like, I just got hooked there 3 times. So from the very beginning, it really changed everything.
There's natural lubricancy that goes away completely. There's drive that completely disappears.
It wasn't until there was a breakdown in those regions that you started to really understand that, wow, my body's really changing.
As a young single woman, I think probably that's one of the greatest impacts that cancer has on your life is sexual health and intimacy.
When someone's breasts are altered in some way, it's really, really challenging. Our breasts are sort of the feminine manifestations that, we show to the world, and very, very much tied into how we see ourselves as women.
I didn't know that once my breasts were cut away from my body that I wasn't at all ready for the fact that not only are they taken away, but also in a lot of ways, intimacy is pulled away from you as well, or sexuality.
I continued to laugh and realized that the intimacy wasn't everything, and that I was being told over and over again that it was temporary, and that I would be back to myself again. Sorry.
Many of the sexual and intimacy related problems are also directly related to self-confidence. And certainly the two are intertwined. If a person doesn't feel confident, then they don't feel sexy.
Not being able to connect, not even just with my partner, but with myself. I felt completely disconnected to myself at that point.
I didn't prepare for the images that popped into my head or the just complete knowledge. Like, I don't have boobs. Like, holy shit, this sucks. And I wasn't prepared for that. It really, I didn't think I'd have the images. I thought that it would be more emotional or intimate and we would talk about it, but really it was a physical thing for me.
It's also how a young woman feels when she looks in the mirror, and her body is significantly different than when she started treatment.
Women need to explore their own bodies as well and see, what feels pleasurable, what doesn't feel pleasurable. And underpinning everything is communication. You've got to find the words to tell your partner what feels good, what's a no-go zone.
I think what's helpful about communicating with your partner is that you kind of stay within the know with each other.
No matter what happens, if I start crying, it's not you. Or reassuring my partner that, like, I love you, you're not doing anything wrong, there's nothing that you're saying or doing or looking. Because I really think that the partner can take that, personally.
I'm not unattracted to you anymore. I still find you very much attractive, but I'm struggling with this, and this.
I think for a long while I wasn't sure whether it was something that I wanted to discuss.
How do you start this conversation with your oncology care provider or your primary care provider? Something as simple as, I'm having some problems in the bedroom, or, my partner and I are experiencing some difficulties, or, my sex life has gone down the tubes, is really what the healthcare provider needs to give them permission to talk about it. So someone has to open the door.
I have a great relationship with my nurse, and there was nothing too scary to ask her, and I was very blunt. I basically looked at her and said, my vagina is broken, and I don't know what's up with that. What do I do with that?
Moisturizers are for maintenance. Lubricants.
Okay. Did that resonate? And then this one. Perfect. Great. Thank you. So hopefully that resonated with a lot of you. And towards the end there, that conversation piece with your provider, it's so important because, again, like I said at the beginning, It feels so awkward and uncomfortable, but really there's so many women who are dealing with the exact same problem. And in fact, in terms of talking about how prevalent these issues are, we know that upwards of 77% of breast cancer survivors experience body dissatisfaction, and that is regardless of surgery type. So mastectomy, lumpectomy, going through reconstruction, whatever. We also know that upwards of 73% of breast cancer survivors experience trouble with sexual arousal and sexual desirability, and 64% can experience disinterest in sexual activity. And it should be noted that this is true, the difference between breast cancer survivors who are experiencing these symptoms and essentially age-matched peers is significant. So if you are postmenopausal and you are experiencing these symptoms, there's a significantly higher rate in breast cancer survivors than other menopausal women who have not gone through cancer treatment. How do you heal? All right, so we're coming to the hope part of this. Okay, so there's some basics that you likely know. One is simply education. So talking to your providers and essentially seeking that reassurance that you aren't the only one dealing with this and there's something that you can do about it. And that something that you can do about it part is so important because it helps you reclaim some sense of control over all of this. We also know that physical activity is incredibly important. Obviously, you think of it for things like weight management and fatigue management, but we know it also improves mood because it affects the serotonin levels of your brain. It also enhances the production of endorphins, which is your body's natural morphine. And it also burns off excess stress hormones. Another thing that's really important to consider is social support. So being able to go to even support groups and coming to services like here at Wellness House, it allows you to interact with other women who have gone through something similar and you can really relate to one another. It's different than talking to someone else because you have to explain everything, and it's just kind of nice to be present with someone and know that you don't have to explain anything and they get it. Couples therapy. So obviously I'm a psychologist, so I think therapy is great for everybody. But couples therapy in particular, when we're talking about body image and sexual functioning issues, one thing that it can do is help enhance communication and also help sort of restore the relationship functioning. So I don't know if any of you have heard of John Gottman's love languages. Does that sound familiar to anybody? It's basically the idea that in a relationship, two people give and receive love in certain ways, and sometimes it happens that you literally are not speaking the same language. So sure, you're showing each other love, but you're on totally different wavelengths. And so couples therapy can help bring you back onto the same wavelength. It can also help restore intimacy, and you can explore your definition of intimacy. So a lot of times when people think of intimacy, they think of it only as sex, and it doesn't have to include only sex. It is so much more complex than that. Cognitive behavioral strategies can be incredibly helpful. So what you have here, basically, cognitive behavioral therapy, it suggests that thoughts, feelings, and behaviors are all interconnected with one another. And if you can imagine sort of in the middle here, you have physiological sensations. Okay, so they're all interconnected. And what cognitive behavioral therapy says is that if you change anything in this triangle, then you are going to be able to help manage some of those negative affective experiences that you may be having as a result of body image distress and sexual dysfunction. So for example, in regards to thoughts, if you are having the thought that my partner doesn't find me attractive, well, my assumption is you're going to feel pretty bad about that. That's going to make you feel bad. And when you're feeling bad and when you're having those thoughts, that's gonna domino effect into more thoughts, and it's gonna impact your behavior. So you are probably not going to you're probably not going to work to connect with your partner. You're probably going to avoid any sort of intimacy in fear that you could potentially be rejected. So cognitive behavioral therapy says, well, what if we can do something about that thought? What if we can do something about the thought of my partner doesn't find me attractive? Because that's a pretty big assumption. So maybe you can say, I don't have any evidence that my partner doesn't find me attractive. And over time, as you're restructuring some of those negative thoughts like that, it can positively impact all these other parts of the equation. Let's see, I'm trying to be mindful of the time. So this is one exercise that I do with my patients called Picture Yourself Happy. The idea here is to look back on pictures of yourself and look back on a time where you were at your happiest and describe 5 qualities that you saw in yourself through that image. And then we talk about what was your self-image at the time that that photo was taken. What qualities do you embody? And do you continue to embody those qualities? And it goes to show that self-image is a lot more than just how your body looks to other people. Your identity is made up of so many different pieces and so many different qualities, and it's really important that you expand your view of what your self-image is. So for folks who may be particularly nervous about looking at themselves in the mirror, maybe they can't wrap their head around how much their body has changed. And so what tends to happen is you start avoiding looking at yourself. You avoid looking in the mirror, you avoid looking at yourself maybe in windows as you're walking down the street. And while that protects you from any negative emotions you may be having when you look at yourself in the mirror, it also makes the anxiety bigger. Avoidance makes things bigger. So instead, what you should do is you should lean into the anxiety and expose yourself to that discomfort. So that means intentionally looking at yourself in the mirror, looking at all of you, and then being able to make a list of qualities and features that are most satisfying to you, and then focusing on those parts of yourself every time you look in the mirror. So the idea is to have this balanced perspective, rather than just looking at yourself and just seeing those things that you feel are negative. Focusing on things that you're satisfied with allows you to have a more balanced perspective, and therefore can help impact your emotional well-being in a positive way. Okay, so I'm sure a lot of you have heard about mindfulness. So it's been really big for a number of years now, and mindfulness provides a very unique way of being able to look at problems and emotions and some of the negative thoughts that you may be having. So I put this up here, just think positive, because I hate it when people say this, because what that assumes is that you can control your thoughts. So it's like, oh, just think positive. That's all I had to do. Thank you. Thank you for that. It assumes that you can control your thoughts. And as human beings, we cannot control our thoughts. If you figure out how to control your thoughts, let me know. So if I tell you to try as hard as you can not to think of a pink elephant, what do you think of? A pink elephant, exactly. So what mindfulness does is it tells you that you're not going to be able to stop these thoughts from coming into your mind, but you can change the relationship that you have with them. So you can't stop the waves, but you can learn to surf. So mindfulness is about paying attention in a particular way, in the present moment, and without judgment. So essentially what happens is the surfboard is mindfulness. So when you are out there and you don't have a surfboard, you are getting pummeled by waves. You're getting pummeled by some of those negative thoughts that you're having about your body. And when you have a surfboard, you're out there, you're still experiencing these huge waves, but you're able to ride them out, and they don't have such a significant impact on your well-being. Mindfulness is simply just noticing what is happening right now in this moment. So you're taking notice of how your body feels, of your emotions, of where your mind is and of your surrounding environment. So it's simply, I'm noticing that my heart is racing right now. That's probably what I would have said before I started talking. I'm noticing that I'm feeling sad. So taking notice of what's happening, and what this also does is it creates distance between you and that feeling or that thought. And so it feels easier to not allow that thought or that feeling to consume you, to be that wave that pummels you. There are a number of different types of mindfulness. I'm going to skip that. The two that I think are most relevant, given our focus on body image and sexual functioning, would be compassion meditation and positive affirmation. So we know that our brain is essentially wired to pay more attention to negative stimuli. So what we need to do is we need to give ourselves a fair chance. We need to balance our perspective. So we need to be able to see both the negative and the positive. So we have compassion meditations, which are helpful for not only self-compassion, but also thinking of someone that you love unconditionally and maybe someone that you're struggling to love. And then we have positive affirmations, which what you do is you think about good things that happened today. You think about what your role was in contributing to the good thing. So instead of just, it was luck, well, what role did you have in that? And then being able to describe what was the positive emotion that fit how that good thing made you feel. So instead, again, you are experiencing both these negative thoughts and emotions and also the positive ones to have that truly balanced perspective. I have a number of resources that are on the slides that you all have. Organizations, websites, publications. I would highly recommend, if you're in for a book, Full Catastrophe Living by Jon Kabat-Zinn. He brought mindfulness to America.
I think your packets were short. Yeah, we don't have
Oh.
after your little smiley face, frowny face.
Oh, okay. Okay. Well, so I can leave these up. And I do want to point out, so obviously with apps now, it's like relaxation apps are a dime a dozen. The three that I find most helpful would be these top three. So Mindfulness Coach, that was actually created by the VA, but it's for everybody. Calm is awesome. I use this all the time. And Simple Habit. So those are free apps that you can download. And really helpful with mindfulness meditation, relaxation, etc. And then just, searching YouTube is completely fine as well. That is all I have. Yeah, no problem. I'll start here, the first page.
And we will make copies. And if you're staying until the next session, we'll have them around the house. Sorry about that. Seems like some packets missed a page. So now we will open up the floor to some questions, comments, if there are any. All right. Well, thank you. Looks like we ended a few minutes early. Thank you, Dr. Hunter.
Yeah, thank you.